This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Robinson, welcome. Tonight I'm pleased to have Brian Ricketson, a trauma survivor, and Dr. Dennis Ashley, chairman of the Georgia Trauma Commission. And we're going to have a conversation tonight about some of Brian's misadventures and adventures as a trauma survivor and some of the care that was rendered to him, and a good deal of that by Dr. Dennis Ashley. So Brian, if I can start our conversation, your misadventures or adventures started some years ago. You were a 17-year-old lad at the time. Is that fair to say?
Yes, sir. I was 17 and ready to go at anything.
And as I can recollect this story, this was in Monroe County. This episode happened.
That's correct.
And you were actually on the way to your girlfriend's house. Is that fair to say?
Yes, sir.
And she was requiring your presence, and you were putting your foot on the accelerator. Is that correct?
Quite a bit.
Well, you know, sometimes that's the power these females have. That can sometimes happen. So, you almost have no recollection of really anything. Just you're on the highway, and
last thing I remember is walking out of the door.
And then then you've learned some of the details about what transpired when this episode occurred, but. You were driving very rapidly, is that right? What did the police tell you later about how fast you were going?
They told me that I was doing 85 and a 35.
Well, that can happen, can't it? That's bad. That's bad, all right? That's bad. And then I think we have some pictures, do we not?
Yes.
Maybe we could show those pictures of what happened to your car. I mean, if that's possible, we'll do that. And I think we're seeing those pictures right now, and obviously it looks like a pretty bad smash up. Now, you tell me about your seatbelt. You were wearing a seatbelt at the time, and what did the people tell you later about the nature of this accident?
I was wearing a seatbelt. It actually saved me when my car was flipping, and it broke just before my car hit the oak tree, and I fell into the passenger side out of the crush zone.
So if you had not worn the seatbelt, I mean, you would not be here. Is that correct?
I'd have been tossed around the inside of the car.
All right. So you had terrible injuries, and we'll talk about those in a little bit. But I would say God was on your side that night. Tell me what happened at this point. You had this terrible injury. Later, people described what occurred. What happened?
Well, my accident was in the country. But luckily there was a gentleman standing in the driveway of the house I wrecked in front of with a cell phone in his hand. He called 911, and there was a paramedic team on the road that intersected right where I wrecked, finishing up a call, and they made a response time of 2.5 minutes.
So they were able to basically rescue you, and in this case, they rushed you to the medical center, did they not?
That's correct.
And then maybe I can ask Dr. Ashley to make some comments. I mean, you had extensive injuries, and maybe you can just talk about some of those injuries, and maybe Dennis, you can jump in here and comment upon that. But you were in coma, I think, for 2.5 months. Is that correct?
Yes, that's correct. From the accident, I had broken both my collarbones. I broke and separated my left shoulder. I had a brain injury on the right side. My collarbones had actually punctured my lungs, and my lungs collapsed. And they later found a contusion on my small intestine.
Well, Dennis, can you make any comments about about Brian's situation, and then what the routine situation? We've discussed that before, but just his long period of convalescence in the intensive care unit, and what some of the contemporary, and I would use the word miracles, that happen to redeem people from these serious trauma injuries. Can you make some comments about that?
Sure. Well, I think one of the first things that Brian pointed out there that is really amazing is that his response time from the paramedics was only about 2.5 minutes. and they just happened to be finishing another call and was in the area. That doesn't always happen, and we need to get first responders. Sometimes it's fire personnel, police that get there maybe even before the ambulance. So it's important to get someone to that injured victim as soon as possible. And on the Trauma Commission, you know that we've been dealing with first responders and with EMS, and this year we plan on training about 1,300 first responders to increase our capacity to get the rapid response that Brian had. And I'm sure that has something to do with your survival, because you could have very easily quit breathing at the scene and if they hadn't have got to you in time.
And so really you were brought in, you were taken to the intensive care unit, and this is the kind of injury that really needs to go to one of the 4 tertiary trauma centers in the state. Is that correct?
Yes, this was a terrible, terrible injury involving the brain. And that was really just the tip of the iceberg. Once the brain goes down and is severely injured, as you know, other organ systems start to fail. And at one point, Brian had about 5 or 6 chest tubes. Those are tubes that go in through the chest, through the ribs, into the chest cavity to suck out air and let the lungs re-expand. His lungs were so bad. And once they had been injured and bruised, they didn't work correctly. He had to be on a ventilator. And if I recall correctly, he was on that, a couple of months on the ventilator. Once his lungs failed, then we progressed to kidney failure. Not that his kidneys were injured in the accident, but with all these chemicals floating around the body and all this other trauma, your kidneys failed and we had to put you on dialysis, continuous dialysis around the clock in the ICU. Fortunately, you don't remember any of that.
Now, Dennis, can you describe a little bit about, so what we're really looking at is multi-organ failure. And this, we have to have a team ready, we have to have an apparatus ready to handle this kind of injury, but what about the kidneys? I mean, why did Brian have dialysis? What would be the reason to do that?
The reason would be as he quit making urine. His kidneys shut down from the shock, from all the chemicals released from the trauma in his body. We call them cytokines. That's just a fancy name for inflammatory chemicals. Some of them are good, some of them are bad. We need those chemicals, but in a trauma that you can get too many of those chemicals released and it can shut down organs. Once you don't make urine, then he could not secrete and get rid of the various toxins that his body was building up, and that made the coma worse. He already had a brain injury, so this now we're putting a chemical coma on top of a traumatic injury. It was very bad for his brain.
Now, Brian, as long as we're here, I'll just make some random comments about how the brain responds to injury and why it's important to be in this kind of environment. One of the things that happens is the brain can be injured, it can swell, and some of the cells can die, they can be threatened, and so we have lots of tricks in our bag to minimize the swelling, to control intracranial pressure, and one of the reasons to be in an intensive care unit is that we try and maximize the brain's environment, and we keep a close eye on things, and that was actually one of the biggest developments of this whole issue, is you survived a brain injury, and you've come back extraordinarily well. We'll start to talk about that. And maybe this is a message to people that are watching this about how recovery is possible. I mean, I think you're what can I phrase it? How can I phrase this? You're an extraordinary example of what can be accomplished. So you were in the hospital for a long time. What's the first thing you can remember, Brian, when you came through this?
The first thing that I can really remember is waking up and my father and my Aunt Lori were there. And the last thing I remember was walking out of my dad's house. So
yes.
I was really confused as to what was going on.
And that must have been quite an experience to wonder what had transpired. And they were supportive. They were there for you. And then did you lapse back into coma, or what happened after that? Did you gradually come out of this? Or?
Well, apparently I had that scenario I just described happen multiple times, but I only remember it happening once. I gradually began to get better, and I remember longer and longer periods of consciousness in the ICU.
And so there came a day that you left the intensive care unit. Can you remember that? Was that a big day?
I can remember it vaguely. I left the intensive care unit at the medical center and went to Shepherd Catastrophic in Atlanta. There was a lot of transport. I remember being loaded into the ambulance.
Yes.
For the transport. I remember a few other vague details.
Yes. So this was a 17. You're a healthy 17-year-old guy trying to get to your girlfriend's house, and these events happen now. Dennis, can you make a comment? This is the sort of trauma system we're attempting to create in Georgia. And the idea is that there are different levels of care, and there's a role for a place like Shepherd. Can you talk about that, the idea of how patients get to that? What kind of system are we attempting to put in place in Georgia? I mean, so this is a freely accessible experience, and can you make some comments about that, extended rehabilitation and
Sure.
the role that plays in recovery of?
Well, the first job is to save the patient's life, and that's what the intensive care unit is for, to get control of the injuries, the secondary injuries such as Brian had with the kidney failure, the lung failure. And as he said, he was in the ICU for 2 months. You can imagine being in a bed for 2 months,
Yes.
not moving, in
Yes.
a coma.
Yes.
You don't just come out of that, unlike the TV show and
Yes,
the movies.
you just don't wake
come
up
out and everything is fine.
Yes, right.
So there's a lot of work to be done. When the patient actually wakes up, then the rehabilitation has to start. And as I'm sure Brian can tell us, as his memory comes to and some of the therapy he went through, this can take months to get back to normal.
And this is a really important part of rehabilitation and joining society and getting back to your family and your life. And this is the kind of opportunity that we need to have in place for everyone in Georgia. So just can you recollect some of your experiences there, Brian? What happened to you in Atlanta, and what did you go through up there in your rehabilitation?
I remember quite a few things from Shepherd. I was starting to get better by then. I remember when I first got there, I was in a lot of pain.
Yes. Yes.
I really didn't want to do anything. They had to get me out of bed using a hammock to set me into the stretcher, wheelchair, whatever transportation I was going to be using.
Yes.
By the time I left, I
Yes.
left a month. It was about a month and a half later, using a cane.
Yes. Were the people that you dealt with, were they nice to you? Were they encouraging? I mean, what was your experience with? Were there other people in similar circumstances, and did it require all your courage to come through this? And can you make some remarks about that recovery phase?
Yes, of course. The people that worked at Shepherd, the nurses, the physical therapists, the occupational therapists, everybody, they were just incredible. They were so supportive. It was always, you can do this. It really made it hard to say that you can't.
Yes.
There were other patients there. There were actually a few that were around my age that
Yes.
had
Yes.
similar situations.
Yes.
And had just come through basically the impossible.
Yes. Yes. And so you came through this experience, and let's see, Coach Vince Dooley visited you. Is that correct?
Yes.
I'm not sure we have that picture, but if we do, we don't. Okay. But so that was good. So your family was there. You had lots of people that were rooting for you and cheering for you, and that was a big part of it, was it not? I mean, just having that family support.
It really was. I had so many people, family, friends, people I didn't even know, just praying for me.
Yes.
It just, it really made a difference in my recovery.
Yes, yes. And isn't that important, Dennis, if I can say that? I mean, if people that are watching, maybe they've had a family member that's been involved in that, just the family support is just so crucial. And being there for an afflicted family member, that's really crucial. Would you agree with that?
It really is. There's not a lot the families can do immediately in the ICU when they're in that coma, but when they start coming out of that, the family support is tremendous.
Yes.
Because as Brian mentioned, he's vague about when he first saw his dad and his Aunt Laurie. There's a lot of fog there. Sometimes
Yes.
the patients are combative or a little scared. The family members play a big role in comforting the patient at that point. And certainly in rehab, when you're having to work and you don't want
Yes.
to work, I'm sure your dad sort of kicked your butt a few times and said, you got to get out of bed, you got to work, we got to get back home.
Oh, yes, definitely.
And so just the encouragement now, were there some demons you were tussling with then? There must have been a sense of anger, depression, just this just suddenly to be in this experience. You were a senior in high school, is that right?
The accident occurred just before my senior year was supposed to start.
And that's a wonderful time in life. I think you can even remember that, right, Dr. Ashley? I think we all can. It's a good time in life. You're a young man. Life is, the open road is in front of you, and then bang, to have this happen. And well, you had your experience then, and then you returned home, is that right?
Yes, that's correct.
And then you were trying to get back going and get back in school. Now, one of the things maybe to discuss is you had a substantial brain injury, did you not? I mean, you really came through that. And I know there are people out there that are watching that have had, that might have a loved one that's had this situation, but you came back from that, did you not? I mean, the integration back into your high school, and how did that go for you?
Well, it was difficult at first. Right after I got out of the hospital, I actually tried to rejoin my original graduating class and catch up with them. And in the 2 or 3 weeks I had before we had our Christmas vacation, I had actually caught up close to 4 months.
Wow. But then there was some stormy seas out there, and it was. And you had some health problems that persisted. Is that right? You had some abdominal issues and.
Yes, I had some complications from previous surgeries during Christmas break that we decided, it was probably the stress of trying to catch up.
Yeah.
So I ended up going back to school the following year, and I graduated.
Yes, but now were you in a play? Did I hear that story? Or tell me about that.
I was my senior year in high school. I couldn't play football anymore. And
were you a football player?
I was.
So all three of us have something in common? Or at least two of us do.
Well, I played football too.
All right, we all three do.
Okay.
Okay, well, so what was your position?
Well, my favorite position was nose.
Nose, okay. And it was a lot of fun, and you liked it, and wow, what a thing to have taken away from you.
Yeah, that was pretty hard to deal with, to be told that I couldn't ever, dress out again.
Yeah, that's tough, isn't it? That's tough.
So it was really tough not having something to do after school.
Yeah. So
I actually got into drama.
Really?
And
yeah.
I starred in a performance of Oklahoma at the end of my
Wow, that's great. What a good story. What a good story. So as your story has gone along here, you then got going and sort of went on with your life, and now you're in nursing school. Is that correct? I mean, maybe you can sort of take us through the period of convalescence after this horrific injury and how the system has restored you to a useful life. I mean, can you tell us about that?
Yes, it was, I graduated high school and I started college at Macon State.
Yes.
I had a couple of years there with, a few problems, but
right.
I finally got those straightened out.
Right.
I'm in nursing school with Middle Georgia College now.
Wow.
I'm married and just, moving on with my
Well, what a
life.
great story. I mean, and so this is the kind of story that I think the people of Georgia need to think about. And this is why we want to have a trauma system that's in place to take care of this kind of situation. So now, rather than if the system had not worked the way it did, and it's a bit of a fortuitous set of circumstances that allowed these benefits that came your way. If that system had not worked that way, I mean, the outcome would have been far worse. Now you're a productive citizen. You're going to have your family. You're going forward with your life. What a good story. Now, Dr. Ashley, can I make a comment about what the ambitions of the Trauma Commission are about trying to make this the standard of care across the state, to have this kind of story, the common story? I mean, what are some ways we can make this the common story in the state?
Well, the main thing is we want to get the right patient to the right place at the right time.
Yes.
Brian got a great response with paramedics there in 2.5 minutes. Now that's tough to achieve statewide.
Yes.
But we need to be working toward that goal to get paramedics to the scene as quickly as possible.
Yes.
And then once the patient is picked up, we need to try and get that patient to the right facility that has all these things that we talked about today or tonight to give the care that's needed.
Now, what are some of the shortfalls that exist now that we'd like to correct, and hopefully with the help of the voters that are out there that are going to vote on Proposition 2, but what are some things that are on our agenda to make sure this this standard of care is statewide? I mean, what do we plan to do what are some things that are out there, innovative things?
Well, one thing is we have a gap in care. We have a gap between, there's certain areas of the state that really don't have access, the patients don't have access, rapid access to a trauma center. So we need to upgrade some of the hospitals in those areas to have a team ready to go and to be ready to handle those traumas. And that's possible to do in some strategic areas. Then in the areas where we don't have centers and really don't have those resources, we need to have better transport systems, either by ground or by air, to get those patients out of there very quickly to an appropriate center. That's all tied together. The current trauma centers, the ones that we hope will come online with appropriate funding, that's all tied together by a communication center, which we don't have now, so that each trauma center knows which one is on diversion, which one's inundated with too many patients, where we need to shift patients. The paramedics are tied into the system. And once we do that, we can streamline care and get folks to the right place at the right time very quickly. Because the quicker we can start getting oxygen and blood pressure and blood flow to the brain, the better the brain heals. Just like in a stroke, time is tissue, time is injury, time is brain tissue lost.
And so one of the issues that's happening is there are circumstances now that Brian would not be as lucky. Is that right? I mean, is that right now? This is a really good story. It's the kind of story we'd like to have widely established in our state. Let's just discuss this a little bit, Brian. We have this election that's coming up, and the voters we have across our state, we have voters, I would imagine certainly over 1 million voters are going to the polls. And one of the things they're going to vote on is Proposition number 2, which we've discussed in our show earlier, and the importance of putting that kind of proposition in place. Do you have any comments? I mean, is there any message you'd like to, you have a chance to talk now. What do you think should happen, and what are your thoughts about that?
Well, Dr. Robinson, this is a really important issue, and like you said, I'm proof of how important it is to have proper care available. All I could say to people is you never know what's going to happen, but you want the best care there for the worst. I mean, it's just like the saying, you hope for the best, but you should plan for the worst. And that's exactly what this is. Proposition 2 will really help us get the trauma care to where it needs to be, to where it's available to the maximum number of people possible.
And this particular issue is coming down the pike, and I'll ask Dr. Ashley to make a comment on that. I mean, this is. We've had Brian's comment about this, and what are your views? I think we might imagine what your views are, but do you have something to add to anything Brian has said about this?
Well, I think this is what it's all about. You work hard with somebody for 2 or 3 months in the ICU, and then you sit here and you talk to them. It's a great feeling, and you want everybody to have that same opportunity. And that's why many of us, including yourself, have donated of our own time over the last 3 years to get this before the voters, to get them educated in the sense to know that there is a problem. And I think we've gotten the word out. Our death rate in Georgia is 20% above the national average for trauma, 700 lives per year. And that's unacceptable. We want to, as you say, kick the can down the road and get the word out, and I think we've done that. So hopefully tomorrow the voters will vote yes on Amendment 2 so that we can continue our work and building the system so that everybody gets very rapid care and access to care.
If I can make this point as well, I mean, there may be skeptics out there that are concerned that the $10 license tag, and they use the word fee, I'll use that word as well, will be squandered or something bad will happen. It'll go down the rat hole of inefficiencies. But really, we plan to be very restrained with it. The Trauma Commission does. That we're really trying to do a good job with it. And one of the things to be said about this, if you look at the economics of Brian's life, the fact that he's become a useful and productive citizen is a really important issue. There's no if the outcome had not been as successful, then it would have been an enormous burden on the taxpayers, if I can make that comment about it. And if we can construct a healthcare system that we ensure good health for the citizens of Georgia, then that's an economically good thing. And that's where we're all trying to go. We're trying to take the American healthcare system, we're trying to refine it, improve it, make it better. And there are lots of inefficiencies. There are lots of things that are wrong with it. But I think if we can all be on the same team and do something, we can make it better, and it'll be a good investment for the taxpayers. This is not money that's wasted. Brian is going to have a productive life. He's going to be a useful citizen. He's going to pay taxes. He's going to raise his family. He's going to be a credit to his family and our state. And this is what the healthcare system can do, and it's an investment. So when healthcare is appropriately rendered, it turns out to be a very good investment. It's not a negative thing. And I think the citizens of Georgia need to trust the Trauma Commission that we're going, if they will allow us to have the custody of the funds that come to us. We have our pledge. Is that correct? I mean, they have our pledge that we're going to do everything we can to make this system the kind of system the state can be proud of. And I mean, I hope this will be the case. Would you like to address the critics that might have said, don't do this, Dr. Ashley? I mean, do you have any thoughts about the critics that are saying don't pass this?
Well, I think the biggest critic is right now there's a lot of anger toward government and legislation and things of that nature, and no taxes, no fees. But at some point you have to see what our government has given us now. Death rate 20% above the national average, 700 lives lost per year. That's what we have now. So if you want something different, the price tag on that is $10 per year, which I think is fairly reasonable for the return that you're going to get when we look at returns on investment of human life, most importantly. And if you want to make a financial model out of it, when a young person comes back into the system and starts paying taxes, the revenue that they generate, as you've already mentioned, is astronomical. So from a financial standpoint, it is truly an investment. From a humanities standpoint, I think it's the right thing to do.
Now, can I also make this comment? I mean, I'm from Georgia. I've lived here off and on all my life. My name is Joe Sam. If you go to other parts of the country, the idea is that there's something that's second rate about the South and second rate about Georgia. And right now, to me, I think our idea is to make our trauma system the best in the world. And I think we've got the capability with the help of the Georgia voters to do that. We can do something that can be not only a good thing for Georgia, but we can make it a model for the world. There's no reason that we cannot have the best trauma system in the world. Is that fair to say, Dr. Ashley?
I think that's very fair, yes, sir.
And if these funds come our way, we're in the position to attempt to do that. Is that correct?
That's correct.
And this is an issue of enormous importance. What would happen if this is not passed? Do you have any thoughts about what's going to happen to trauma care in the state? What's the likely outcome if this is not
Well, it's been a terrible struggle to hang on to the trauma centers that we have. But with the limited funding that we've had over the last 3 years, we've been able to do that. It's been impossible to recruit new centers to come in without this funding. So if we don't get the funding we need, well, I'm sure we won't recruit any new centers into the system, which we desperately need, and we stand a good chance of losing at least some of the centers that we have now. So I'm very fearful that if we don't get this funding, it will cause significant problems with access.
Mm-hmm. Well, we're getting near the end of our show, but I'm going to make one comment. I'm a true believer in this. I really believe in it. And I think about the people that I've treated in my 30-year career in Macon, Georgia, that did not survive, that had traumatic injuries, and I see their ghost at my bedside every night, and I have a moral obligation to try and make the system better. And I'm strongly committed to that. I hope the voters of Georgia will work to pass this. I hope they will vote tomorrow in this important election. And Brian, I'm going to give you the last word. This is your chance to address the people in this area about your views on trauma.
I really can't tell you how amazing it's been to have this opportunity, to have the care that was provided to me and the people that provided the care.
So, I mean, you know what? That's about it for us, but thank you. Thank you tonight.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.